You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast. And this week's guest, man, she is going to be a powerhouse in the dental industry. She's already achieved so much at such a young age, and it's been my absolute delight to get to know her and to have her on the program today. Welcome, Steph.
Thank you. How are you?
I'm very well. So, Dr. Steph Mulcahy from WA, Broome in WA.
Yes.
Tell us a little bit about how you got into dentistry and what you're doing now.
I actually started off doing a Bachelor of Science at Monash University in Melbourne. So I'm from Victoria.
Ah, you're from my neck of the woods from that perspective then.
I am. I grew up on a dairy farm up near Echuca, on the border of New South Wales and Victoria.
So farm people are so much literally down to earth, and they've got a different perspective on life. That must have been a very good grounding for you.
I think definitely very adaptive and also resilient. So I was lucky that I grew up with that as my background. I went to high school in Shepparton, and then I went down to Melbourne to go to university. So I moved out of home when I was 18 to head down there. And finished off with a double major in developmental biology and physiology with a Bachelor of Science from Monash.
Fantastic.
So I was sort of deciding what I wanted to do. I had a lot of friends that did medicine. I had never thought that medicine would really be the right thing for me. Really, I just didn't think that I was smart enough for it. And then it turns out I was doing so much more detail with the same subjects, you know, physiology and anatomy and things like that, that they were doing. But something that I would cover 10 lectures on, they would only do one. And so, because they had to learn so much of the body in such a short period of time, their learning was really condensed. And so a lot of my friends really encouraged me and sort of said, you can do this, like you already know more than what we do about these subjects. There's no reason why you can't do medicine. And I'd always loved going to the dentist. I had a great family dentist back home, and that was sort of what I was considering. And then, it wasn't until I went to university that I thought that I might do medicine. But finished my degree, and I had a very good grade average. And I had applied for both dentistry and medicine, and I was just sort of deciding what I wanted to do. In that time, I did decide that I wanted to pursue dentistry for a few reasons, mainly sort of family, work life, and also I knew that I wanted to live rurally. And if I had pursued medicine to do the surgical stuff, which is what I was sort of more interested in, I probably would have had to live in the city. And so that was one of my deciding factors as well. Anyway, funnily enough, I didn't actually get into... I got accepted into dentistry after my second year of university, of my undergraduate. But I decided to turn it down because I wanted to finish my science degree instead of having one degree 2/3 finished and then move on to the next. And then just thinking that I would easily get in the next year because I got in that year. But it turns out they were really heavily based on practical, and I hadn't done any more work experience in my final year of university, and so I didn't actually get in the following year.
Damn.
And then I was thinking, what should I do? Should I do honours? Should I go do something else? I got accepted into honours, wasn't super keen on that. Research wasn't really my thing. I got accepted into medical imaging. They said, you're in, but you need to do work experience. Thankfully, I did a day with that and thought, no, this isn't for me. And so what I did is that I decided to actually go work on a cattle station in the Northern Territory.
Wow, wait.
For a year. Yeah.
That's amazing.
And so I learnt so many more skills that year, you know, resourcefulness and independence and things like that. That was the first time. I had lived away from home already for 3 years, but I was, you know, a 2 or 3 hour drive from home. So I used to go home most weekends, whereas when I moved to the NT, that was my first time fully away.
Yeah, and just reliant on yourself to get through.
Yes. Yep.
Yeah.
And I had a great time up there, loved it. I met my now husband. And so that year I did do some work experience both in Alice Springs and in Darwin at dental clinics, both public and private. And then the following year I was accepted into both an undergraduate and a postgraduate degree. And I chose the postgraduate for a couple of reasons. At the time, I thought it was only 4 years, not 5, so that was a good thing.
Ignorance is bliss.
Exactly. But the other thing was for me, because I was the age of a postgraduate student, I thought that I probably wouldn't love to go back to being in a class full of 17, 18-year-olds. So that was another reason as well. And my mum thought that Perth would be a better holiday destination. So
I love it. All these very important things factor into the decision.
Exactly. So that's how I got into dentistry. I always knew that I wanted to do something that was hands-on but health related and helping people, and yeah.
Fantastic. And certainly, I've only ever worked in the dental industry as dental assistant, receptionist, things like that. I had my own practice for 10 years as well, and now as a consultant. But being exposed to other people in other medical professions, especially when I had my practice, we shared the rooms with a gastrointestinal surgeon.
Oh, wow.
And he could never go away that far because he was on call. He would be called in the middle of the night, in the middle of a wedding, in the middle of a funeral, he'd be called away. And I used to say to the dentist, look how good your life is. You don't get called away for anything. Exactly. And so there are so many reasons why dentistry works very, very well for people.
100%. And especially too for women. The elephant in the room, but we're sort of more expected to, if we have family, to take that time off and things like that. So it does give you a little bit more flexibility, or to choose your work hours and have pretty much be sure that you're not going to get called in for.
That's it. And I recently, just a couple of weeks ago, had a conversation with somebody, a friend of mine, and she was saying how downtrodden women are and how hardly done by they are. And I said, you're really talking to the wrong person here, man. I'm coming from a profession where it's actually to your advantage to be a woman.
Yeah, exactly.
And so when you graduated, you were only out for a couple of years before the next thing came along.
I was. So I graduated at the end of 2016. And I chose to work in a remote practice straight out of university, again, for a few reasons. One is because they don't have travelling specialists apart from an orthodontist close enough to most towns in close proximity. But generally, there's no endodontist, there's no prosthodontist, there's no pedodontist. So all those other specialties, you have to do it yourself.
You have to do it all yourself. Wow.
Exactly. And so you become very good very quickly because you don't have the ability to rely on anyone else other than yourself. So I made the conscious decision to choose that, and it did pay off really well. So I do feel like my clinical skills accelerated a lot quicker than some of my colleagues that did stay in the city. And even now when I talk to them, and some of them still don't do molar endos and things like that, and that's bread and butter for us. I wouldn't even think to refer it off unless I really couldn't find the canal or something like that. Yeah. So I worked there for about 18 months really, and I just found that it wasn't really values aligned to where I wanted to be and how I wanted to treat not only my patients but also the team. And so I started looking for something on my own. And initially I wasn't sure how far away to go. So we'd just bought a house. My husband, partner at the time, he was had a really good job, and he'd moved there for me as well. And so for then 18 months later for me to turn around and say, oh, actually,
you're moving again.
I'm not here anymore. Yeah. I felt really bad about that. But so I spent a lot of time researching and looking at what to do and where to go. And it actually, in the end, the practice broker rang me and said, I've had this sale fall through in Broome. Would you be interested? And I said, oh, not really. It's about a little bit too far away. You know, I can't commute or anything like that, but I'll come up and have a look. And I had been to Broome before, so I knew that it was a beautiful place. And I actually applied for a job here when I graduated.
Oh, really?
Yeah, but I
At that very
ended up
practice?
choosing another one. At the same practice, yes.
That's amazing.
And so, yeah, I came up. My dad flew up with me from Victoria, and we had a look at everything, met the team, went through all the books, obviously the financials, the clinical books, and it just worked. Everything just felt right. The town felt homely, and yeah, that was
And you
that.
got to go with gut feeling. You know, it's a big part of your body or of your intuition. To ignore your intuition, I think, is at your folly, because, you know, we can look at the books and we can see what makes sense and if this is a good purchase and all the things, but there's an inner knowing sometimes as well. And it's interesting, you coming from a space. Just, you know, for 18 months in, you'd been experiencing a dental practice that really wasn't aligned with your own values. I'm intrigued as to the next step for a lot of people is I've got to find another practice to work for that's more aligned with my values rather than I have to create my own thing.
Yeah.
Because, and I wonder, you know, with you moving out of home at the age of 18, then moving up to the Northern Territory by yourself, and coming from that rural background, and I imagine that your parents had a lot to do with it as well. But it seemed like you had an inner knowing that as long as I work hard, I'm going to be fine. Sure,
Yeah.
it'll be bumpy, but I'm going to be fine.
I think I'm very lucky in this, like my family is very supportive. My parents do own quite a successful agricultural business, well, the farm, but they've also got a milk factory as well. And so I have come from that background, that business background already.
Yeah.
So I did have a lot of that sort of innate knowledge, and definitely the support. My dad actually was the one that said to me, you know, you could go out on your own. I said, oh, not yet. And he's like, why not? You're already, you know, treating independently, because I didn't have a lot of clinical support and things like that. What's really going to change? And I was actually very lucky, and as you said, with that gut feeling, that the clinician that I bought the practice off, yes, he was, you know, winding down. He did treat the patients more reactively rather than proactively, and that sort of came about because he was a sole clinician and he was always so busy that they didn't even send out recalls because they didn't have time to fit them in. And so it kind of happened not because he was being, you know, not trying to be proactive. It was just because that's the situation or the circumstance that they were in. And so in a roundabout way, it was a reactive or illness-based approach to practice that I was purchasing. So there was a lot of potential there as well. And, you know, the equipment was a little bit tired and a bit run down. So there was some... The practice did need a little bit of work and a bit of money spent on it, but I was young, I was energetic, excited, and because I had his support clinically as well, so he actually stayed on for me. Initially, we agreed for him to stay on for 12 months, and in the end, he actually ended up staying on for 3 years because of COVID, which worked out in my favour.
It worked out in your favour, that's it.
And so it did work really well because even though he had stepped back from managing the practice and I was then essentially the principal dentist, if I did get into a pickle with, you know, not being able to find a calcified canal or a really difficult extraction or something, I was lucky that I did have that clinical support from him. Yeah. Whereas I do know some other friends that have purchased practices, you know, probably not quite as early as me, but within a few years later, but they didn't have that relationship with the successor. And so it wasn't as fluid or, you know, didn't flow as well. Yeah, I was really lucky that I'd picked somewhere that was beneficial for both of us.
Because calcified canals is one thing, but also, you know, knowing the patient base so intimately that he would have been able to really educate you more around that as well. If you kept any of his team members on, giving you the insight about how to manage the team. And really, after you've, you think about now how much you know about running a successful dental practice, think of yourself in another, 40, 50 years. The wisdom that you'll have is fantastic. And I know that it's not always the case where the selling dentist hangs around and it's a nice little happy union.
Yes.
But it can be, and if it is, it's highly valuable, isn't it?
Definitely. And I think also too is that they still gave me the space to treat how I wanted to treat. Having said that, it wasn't until he did retire that I did really change things up. But I also think that came about at a good time, because by that stage I'd been practicing for 5 years, and so I was very independent clinically, and I could focus more on running the business rather than learning the clinical side of things. So I think that potentially if he retired sooner, that maybe I would have changed things up a little bit sooner, just having that confidence to know that you can do it on your own. Yeah. But maybe not. Maybe it worked out well that I did have that time to really consolidate my clinical skills, and then now I focus more on the business rather than the clinical.
I always think about the patient journey too. I mean, when he would have had patients that had been seeing him probably for generations.
Forever. Yeah.
Not just years. And for them to, like, the opposing argument then is that he sold to you, he left, and then it's just you, and you straight away start to implement the changes. And the patient's instantly like, what the hell's going on? This is different from what I've experienced in the past. And maybe it makes that journey of transition of trust a little bit difficult, where the way it did happen, it may have just all been for the greater good.
It's funny you say that, actually, because initially there was, a little bit of apprehension between some of those older patients that have been with him for 30 years that didn't want to change dentists, which I can understand. So we sort of got over that hurdle. So he retired 3 years out, and then that year we brought in a preventative care department, so hygiene or OHTs.
And so that's wildly different. The patients would not have experienced a hygienist or hygiene department in the past.
No, not at all. They'd only ever had the dentist, and really only him, and then locums as well, if, he was going away and things like that. So he'd been that stable, consistent force for 35 years. He owned the practice before I came on. And so there was that sort of transition. So that happened in the first 12 months after his retirement. And then at the 12-month mark, so 4 years after I bought the practice, we then made big changes where we rebranded, so changed our name from Broome Dental Clinic to Dental Code. We opened a dermal clinic, and so I had studied injectables prior to that, and I was doing it out of the dental surgery, but now had a dedicated space for that. And I also then brought on dermal therapists to do the skin treatments as well. So there was a big change in a short period of time, and that was actually the point where a lot of people thought that I had just bought the practice then, not 5 years earlier.
Isn't it interesting?
Yeah.
And so how well, this is going off the sidetrack a little bit, but I'm just intrigued, how well did you need to kind of educate the patients and explain and keep the patients in that loop of change of services within the dental practice? What was your approach to that?
Looking back, I feel like we probably could have done it a little bit better. But we did reassure the patients to, say to them, I'm still there, because I was the principal or the most common denominator at that stage. So I was still there. A lot of all the team was still there. So when you walk in, yes, we've got a new name, we've got new uniforms and new furniture in the waiting room and another section to the business. But the way that we treat and who we are is still the same. We have our core values of confidence, proactivity, innovation, and gratitude. And everything that we do is lived and breathed through those values as well.
They are fantastic values, and to have those firm values and be able to express them in your marketing and messaging to your clients is something that a lot of dental practices never get to. And if they do, they get to it years after practice ownership. What made you so aware that space was important?
There's two things. One is from your treatment approach and the way that you interact with patients. So for us, it's confidence in our ability, but also us having the confidence in our team to be able to perform the treatment or the task in the way that we want them to, or that, you know, is to a high standard. And also the patient having the confidence that the business, no matter who they see, they've got the treatment outcome that they want. The proactivity comes about in taking a proactive approach to treatment, so comprehensive exams in both dental and dermal, and then having regular reviews, 3 months for dermal, 6 months for dental, and making sure that you're treating to the current condition, not what was there 6-12 months ago when you did the initial exam. And also technology. So I may have a slight addiction, but I like to invest in the latest technology. So with our dermal clinic, I mean, we only opened just over 12 months ago, and had all this new equipment, and I've already purchased more equipment on top of that because I just want to make sure that we have the latest, greatest, and the best treatment to be able to treat as many patients that we can. Same with dental. So we've just installed an ICAT, about 12 months ago, an ICAT cone beam CT as well. And so that allows us to not only do more comprehensive treatment in our clinic, but it means that specialist dentists, so say a Max Fax or perio, someone that wants to do implants or surgery, they can come to our clinic as well, instead of 10 patients flying down to them. If we're able to get access to the hospital, which is our biggest hurdle at the moment for GA, then one clinician can fly up instead of multiple patients flying down.
Magnificent.
Yeah. And also I guess that comes through for innovation as well. And gratitude is, I'm grateful for our team. I'm grateful to have, such a great place to live and work, and grateful to have learning opportunities for me, but also to be able to give them to our team. And our team are the same, so they're grateful to have the opportunities to learn and grow, both personally and professionally, because we do a lot of development on personal development, because I believe that you can only develop professionally as much as you are personally. So if you don't develop personally, it caps how much you can grow professionally.
Yeah. And I've always encouraged dental practices to look outside the dental scope in terms of offering different training for your team members, because you're right, if we understand ourselves better, we work better with each other.
Exactly.
And you want a nice, happy team. You don't want to restrict that down and limit their learning. We want to, and when you're attracting and recruiting people as well, when they discover that that's the kind of environment that they're coming into, you are going to attract people who also enjoy learning and growing and getting better.
Exactly. And so, sorry, I went on a bit of a tangent and I didn't actually answer your question, but you've just answered it for me. The main reason for the values is to attract the patients, which I guess is what I was getting at before, that our values align as well, but also to attract team members. And that was the biggest thing for us, because for us to be able to deliver a service of a certain standard, then our team need to be on board and have the same values and want the same things for both each other, the patients, the business and the team.
And it's really that recognition that not just any warm body will do. We want somebody who's a great rapport builder, very caring and compassionate, high level of professionalism and friendliness, all of these magnificent characteristics. And I think, it's so easy to fall into that basket of reactive recruiting where you're just trying to grab somebody because we need somebody next week or in 2 weeks' time. We just got to get somebody in there. But you are losing a massive opportunity, gaining a problem most of the time. But when we do have people that are fulfilling the role, and I remember my working buddy Amina quoted me something from Steve Jobs the other day, and I've requoted it so often, and it applies here as well, that when you employ A-type personalities, or the kind of that deliver that A level of performance, that team becomes self-policing.
Exactly.
No longer do you have to be over them, just come on, do better, come on, keep
They're
going.
Self-motivating as well. They want to achieve. That's one of their core values themselves.
Yeah, that's it. So how many years into your practice ownership are you now?
5. So 5 on the 1st of Feb, just gone. So 5 and nearly 2 months.
And has it gone quick?
Quick and slow. It's been a journey, and don't get me wrong, I've learnt a lot of those lessons the hard way as well. The reactive recruiting, that was one of the biggest lessons that I learnt, and I have actually noticed a huge difference since we have rebranded and really defined our core values, our vision and mission. We are attracting the type of people that we want to attract as well. Whereas before, you're competing with every other dental clinic that, you all come across as the same sort of thing, even though you might not be internally, but that's what you're portraying out to the market or to the world, and that's all they know of you because they don't actually know you personally.
And it's like, it's just as important to understand who your ideal patient is or avatar is, and also your avatar team member as well.
Definitely.
Because it is like, again, generally, as a general rule, a lot of people just say, we just want all the new patients, bring in all the new patients. And then you try to make your systems and service appeal to generally all of them.
Yes.
But you miss the mark on all of them. But when you start to really understand and niche down, these are the kind of patients that we've developed. We see everyone, but these are the people that we message to, we market to, that really will appreciate our service. You are so much more effective at designing that service that that patient really wants. But on the flip side, with that ideal team member, if you're attracting kind of anybody out there, then the sort of things that you're doing is making sure that generally our pay rate's the right thing, and generally we're going to give people the right holidays, and maybe we're going to have Friday afternoons off, and once every quarter we'll go out for dinner together. And so you're kind of a little bit vanilla. But when you know exactly who you want, we're here to grow, we're here to master what we do, to thrive in developing a high level of customer service and huge job satisfaction because of it, and we get better individually, therefore as a team we get better, and we're doing the dermal and the dental, and look at all of our marketing and branding. Do you want to come and work here? And then we know exactly how to treat that person, what environment to create for that person, so they jump on board. What you've promised they see in actuality, and then they want to stay.
100%. And also another big lesson is you don't want to hire 10 people the same as you. You want to hire people that are going to contribute to the team in ways that you can't. So, I know what I'm good at, and I'm becoming more and more aware through that personal development on what are my strengths, and then I need people to counteract that. So there's no point having 10 people that are strong at the same thing as me, because then the same areas that need attention are going to be missed because you're all strong at the same thing.
And that's a really interesting thing, and I haven't heard that before in terms of coming from a dental practice owner. But I think that's enormously powerful, because when you say, I'm seeking people, I've got my strengths, so that's covered, that area is covered. But we need strengths in marketing and promotion, we need strengths in customer service and compassion, or all the things. And I need to appeal or bring into my team people who are really good at things that I'm not really good at. And because of that, how can you possibly be a micromanager and a control freak? So exactly. I think it puts the owner in the right frame of mind too.
100%. And also, if you go deeper than that, it's not always just the skills. So my practice manager is very good at systems, policies, summarizing things. I'm terrible at that. I'm, bigger picture thinker, start a lot of things, and then who can I give this to finish this job? Because I've started this massive project and I'm a details person as well. So I take on too much detail, and then I need someone else to then be able to break it down and summarize it for me and simplify it. And so we've figured that out, that we work so well together. And so I'm the one, usually I might come up with the ideas and then I take it to them, we refine it together. They bring, more knowledge or ideas to improve my initial idea. And then we all work together to get the best result, depending on what we're doing, whether it be for the patient, the services, or the just the business model. For example, how to present financial data to me. I've actually finished my MBA, so I can read all the financial information and I can understand it. But for me to sit there and read that takes a lot of brain energy for me. If I can employ someone that loves doing that, then they can present it to me on a graph and I can look at it and make a decision in 2 seconds. That's a much better use of my time than me sitting there and spending 3 hours to do the same thing.
Yeah, for sure. I was just at the Dental Expo over the weekend in Sydney and looking at all the AI stuff and the elegance now of dental practice management software. Back in the day, it was really just kind of account tracking and appointment tracking and plotting and in essence, a digital version of the treatment card. Nowadays, they're pulling reports, information left, right, and centre, and you've got access to this enormous amount of data. And I was mentioning to one of the people that were at one of the stands, and I said, this is going to be the next role in dental teams, because I could live for another 5 years while everyone's coming on board with these more updated dental practice management software systems. And I'll be able to say to them, this is all the data that this system can deliver you. How much of it do you look at? And they'll all say none. Yeah. or they'll still say new patient tracking and referral sources and those more basic ones. Yep. Because I think there is a big knowledge gap. And I think this is a magnificent opportunity. You were saying before about hiring people and their strengths, that get that next practice manager or any member of your team that is fantastic at being able to assess data and then make sense of it, so you can actually build strategies around that. And it's just this, evolving space of what your team's going to end up looking like.
Exactly. And you don't know what you don't know. And, 10 brains together are better than one. But also, if you invest in making your life easier, so buying back your time essentially, then it gives you so much more brain space to be creative and to think of those new ideas instead of being stuck in the day-to-day rat race or, on a hamster wheel. And you're just so busy. You're in the clinic all day. You come home, you're tired, you eat tea, you probably sit down and do your emails. And on the weekends, and you have to catch up on all your admin because you're so far behind because you don't have time during the week to do it. You don't have that time to be creative and to actually sit back and analyse a business and think, what can we do next? How could we make it more efficient, or how could we grow or make it more profitable? But if you have all that taken care of and all you have to do is follow your strength actually. It might not even be being the creative in the business. It might be treating the patients and you have someone else doing that. So whatever you're really good at and what you actually really like doing, then you're going to be able to bring that strength to your team instead of spreading yourself so thin and then not really being helpful to anyone.
Yeah, because your own self, your relationships suffer, your relationship with yourself suffers. You get this constant kind of resistance to anything new coming into your world because you're like, oh, something else to sap even more energy. I don't have time for the stuff that I've got. Now I've got this as well. And, Dan Sullivan, I think it was in his book, maybe it's this one, got it right beside me, 10 times is easier than 2 times.
Yeah.
But talking about the value of having a regular day. I think he even talks about a day a week, but even just give yourself a day a month where you don't actually plan anything. You're not in the surgery. Just go out for walks, go out for a drive, go to the market, do whatever. You need that kind of break away from the minutiae to be able to hover up a little bit higher and say, am I still on the path? Is the vision still true and correct? Do I need to make any adjustments?
Exactly. And also to look, if you do go for a drive, as you said, or even go on a holiday or something like that and not have to worry about doing work stuff, you can actually take in the environment around you and bring ideas from other industries back into your own business. But if you're so bogged down in your day-to-day, you just can't take any more in. You're already full. And so I'm a huge believer in that as well, and outsourcing as much as possible.
Beautiful.
Yeah.
And now that you're 5 years in, you've done it all by yourself.
Mm-hmm.
there are people out there that I'm sure would be tossing up whether, do I do this by myself? Do I get a partner involved? And, you could be working with somebody that you're or a buddy you went through uni with that you think, oh, we collaborate so well together and we've got the same kind of vision. What would be your advice around, or I shouldn't say your advice because it all depends on so many things, but what's been your experience in doing it on your own? 5 years in, are you really pleased it was just you, or do you say, oh no, it would have been handy to have a partner?
It's been a hard journey, and it's only really been this past, let's say 6 months, but really this year. This year I've cut back my clinical time and I'm spending more time on the business. And I feel so much, as I just said before, more energized and able to focus on the strengths that I am good at. Prior to that, I was working from 8 till 6 in the clinic, seeing patients every day. I was studying my MBA. I was running the practice on top. And it did take a huge toll on my team. Not so much that they weren't angry at me or anything like that, but they felt like, well, I think they felt like I wasn't able to support them because I was just in the clinic all day seeing patients. So I didn't have time to see them. And if they needed help, of course, I would go into their clinical room and treat the patients. Or I always said, put a time in my book and I will chat to you whenever. Like, you don't have to feel bad about it. But they innately do. And so by being able to cut back my clinical time, I've put in dedicated times so that I can communicate with the team and they know that I'm available at those times that they can talk to us. But the other thing that I did was previously I had a practice manager who was also on reception, which I think is quite common. And because of that, she was on reception probably, that took up 80% of her time. And so she could only do 20% of the practice manager's role. And then I did the other 80%. So now, or at the start of last year, so at my 4th year out, I put on a dedicated practice manager and it's her role to check in with every single team member, which I think we're now up to 17 or something like that, every month. And then she reports to me. And so not only is it freed up my time that I only have one person reporting to me, but the rest of the team know that, in those certain hours, they can make time to speak to me as well if they can't bring up their issue with the practice manager. But that doesn't really happen. And so it gives me time to work on the business instead of in it. Because if you're in it, you can't see anything else around you. You can't improve on your systems. You can't, write up all your policies and procedures. And a lot of the time it's in your head, but also either your practice manager or your receptionist or something like that. And then when they leave, you don't have anything. It's all,
you lose it all.
Yeah, exactly. And it takes a long time to get that back.
Yeah, and I agree. I think even when you're at a certain size, having a full-time practice manager makes perfect sense, because how able is somebody who's clinically there all the time and they're also trying to practice manage the practice as well? How willing and able are they to foresee a different vision, introduce different technology, do something different that's going to require a lot of communication with your team members and your patients to do? You may be kind of unconsciously resistant to all of that.
And also suppliers as well. You can't sit there on the phone and treat patients while you're trying to communicate with suppliers or whoever, new policy implementers or something like that. So if you don't, I guess to answer your question in a roundabout way, it depends on what your strengths are. If your strength is clinical, then I think focus on clinical, and whether that be you team up with someone to help you with the business side of it if you do want to own your own, or if you just focus on your clinical and find a practice that is values aligned.
Your vision at the start, did you have a very clear vision when you first purchased the practice, or did that kind of evolve over the initial couple of years?
I think in my head I had a clear vision, but the way that it was articulated, or how clearly it is articulated now, that has evolved.
Yeah.
Yeah.
And where you're sitting right now, and because you've achieved so much in this last 5 years, you've transformed this whole practice quite extraordinarily. What does it look like in the next coming kind of 5 years, 10 years?
So we're actually in the process of building a new clinic.
Aha!
I have been spearheading a building that is a bigger project. So we're part of that, our business, but it's going to be a health hub that's got GP, pharmacy, daycare, psychiatrist, a health food cafe, a MRI, which will be the first one north of Geraldton, if anyone knows WA, in WA. So not now, everyone from the Pilbara and the Kimberley, which is the northern third or half nearly of WA, has to fly to Perth to get an MRI. So we're going to have one in this new building. And then, of course, our clinic, the dental dermal clinic. So I've been involved with that project, so building that to improve healthcare for our community overall, to improve the collaborativeness, losing my words, between our clinic and other healthcare professionals. I think definitely in dental, because we're fully private, we're kind of forgotten about a little bit in the allied health space. I know that a lot of the allied health professionals have a lot more communication with each other and with GPs than what we do. So to put us in the centre with that. But the other thing that it improves is in our area, and I don't know if it's just a WA thing, you may know, but have you heard of PATS, patient assisted travel?
No.
So when the patient lives remotely, they are eligible for PATS for medical conditions that cannot be treated within the area. But dental isn't covered.
Even though it's got, you've got a toothache, all of a sudden you're like, why? Why isn't it covered?
Exactly. And so if I suspect something, a lesion, soft tissue lesion, and I think that they need to see an oral medicine specialist, I have to refer them to the GP, and then the GP has to refer them down if they want to be able to claim the assistance, I should say. They can go private, that's fine. But a lot of patients get lost in that. They might not be able to get an appointment with the GP for 6 or 8 weeks. And so then they just don't. And then they'll come back and see me and say, oh, did you get that lesion on your lip checked? Oh, no, I forgot. Whereas if we're in the same building, they can literally walk out of our door, walk straight into the GP practice, make the appointment, and then less likely that things are going to, get forgotten about. We're going to double the size of our practice almost in the process.
That's I love that you call it a health hub too. It sounds fantastic. And, to really bring back that whole systemic approach to the human body and to health, that dentists, the oral condition is directly linked. There are enormous numbers of studies that directly link it to the rest of the body. And if you've had stroke, cardiac issues, diabetes, all the things, then you have to make sure that you're maintaining your oral health as well. And when you're coming into that health hub space, you're able to really put that into direct practice.
Exactly. And it puts it into a better perspective for patients as well, and for them to understand if you're in that building, then it's all a collaborative approach.
Yeah. My mum is currently in hospital, and she's had, for some reason, the minute she gets into hospital, all of a sudden these other things, the main cause for being in there has all been solved now, but now there's been like another 2-3 things happening, and all minor, but you have a different doctor come in each time. They give a different version of what your condition is, and they've got their own advice, and never do they really interplay with one another. Yeah. And you always feel like, where's the facilitator? Where's the patient coordinator to make sense of all of this stuff?
Yeah.
And, with this health hub, to be able to then be in communication with other health professionals, so you can start to see the barriers for understanding and education and fill those gaps. And the patients are going to become, the more educated we get, the better we get.
Exactly. And as I said before as well, because we're in a remote area, we don't have those specialists that come to town. And so, it just, again, it makes sure that the patients can get the best care that they can in our community. And whether that be in our clinic or in one of the other businesses that are within the centre, it doesn't really matter as long as the patients are looked after and cared for.
I love it.
You just reminded me, we do have a patient advocate in our practice as well, and that is her sole purpose or exact role is to be there for the patient and to make sure that if they have a complicated treatment plan, they understand it, they understand all the costings, their options. But also if, say, the treatment plan was done by me, for example, and then they go see another dentist, because she's been involved in the whole process, she's able to then relay any information that might be missed. Or if the patient doesn't quite understand the way that one dentist explains it compared to another, that's where she comes into play, and it's been really beneficial as well.
It's such a crucial role. I think a lot of the time when things are being explained to a dental patient and the dental patient kind of nods along and doesn't say things like, I don't understand what you're talking about, we think that they are understanding everything.
Exactly.
But they simply aren't. They can't understand it to the degree that we need them to understand it, to fully appreciate all the things that are going on in that treatment plan if it's a complex treatment plan.
Mm-hmm. Exactly.
So well done having that patient advocate. I think it's enormously helpful because that's where you get a level of understanding. I was a patient that in the practice that I did this role, it was called a patient facilitator. But I love the word advocate because in the title it indicates to the patient, I'm here for you. My whole purpose is to make sure that you are looked after.
Exactly. And often they've got more time as well. So if the dentist explains something and then the patient advocate is in the room, they can then take them out to their private office and go through it with them again and make sure that they are actually understanding and not, as you said, just nodding along.
Yeah, that's it. And even that perspective of, the dentist said I could ask more questions and give a call back if I needed to, but I really don't want to waste their time. They're probably seeing patients. They're probably too busy, so I'll just be quiet and just kind of go along. Patient advocate's a different thing. I'm here to answer all of your questions, and so it's such a wonderful role. Congratulations with that. Now, you've recently started a podcast, Growing with Grit. Tell us about that.
I have. So speaking on podcasts speaking in general actually is something that was really difficult for me. Speaking in public, I should say, was very difficult for me previously. I became heavily involved in the Broome Chamber, so I'm actually the secretary on the board of the Broome Chamber. And with that role came a little bit of responsibility and, can you MC this event? Or I ended up co-emceeing the Broome Business Awards last year, so with sort of 400 people present. And I realised that throughout that process, I had so much knowledge to share. I personally think that the stereotype of a dentist is an old, boring...
Sorry, the old boring dentist out there.
Yeah, exactly. And I just wanted to change it up a little bit and just, let the industry or the younger generation, but also patients, if they want to listen, that there is a different way of doing things. And yes, obviously we have very strong regulations and things like that we need to follow on it. And I'm not for 1 second advocating that we don't, but more about the running of the business. And as we discussed, the patient advocate or having different people in different roles to make it easier for the business owner or the principal dentist, and just being able to share my knowledge in that area.
Of all the conversations you've heard on podcasts, read in books, spoken to other people at networking events or dental events, you know that you've benefited so much from those sort of different perspectives. It's not like you turn around and do things the way they do it. It just gives you another perspective. So you've got more data in your brain, and so you can start to visualize a different future for yourself.
Exactly. And I think that everyone resonates with different people as well. And that goes for business coaches, clinicians. So, one patient might prefer to see one dentist over another, and it's not got anything to do with their clinical skills, but you just tend to resonate with one person more than the other. And so I think if there's more people to have a different perspective on things and to give even if I give 5 people someone that they really resonate with in comparison to a dentist of a different generation, then I think that hopefully I'll be able to help.
Oh, you will. There's no question about it that you will. And I think it's coming at a fantastic time because the recruitment landscape looks wildly different now than it did even just 5 years ago. The amount of technology that's coming through has been massive over the last 10 years, and even more now with all the AI stuff coming through as well. And as we were mentioning before, the kind of data that we've got access to about our own businesses and the results that we're generating. But even the approach to team members, our approach to work-life balance and stress, it's all changing.
Yes, 100%. And like, I grew up on a farm. That's what they do. They work 24/7, and that's what all I've ever known, and that's what all I've ever done up until 3 months ago. And I feel so relaxed now. Not that I didn't knowingly feel stressed before, but I just, like yesterday, for example, I sewed a button on this outfit that I've not worn just because it had a button broken on it. But I've never had time to sit there and sew a button on where I don't have anything more important to do. So it's just being able to be present in the moment and with the people that you care most about, your family and your friends, and not be so caught up in work that you can't think about anything else or think about work but from a different perspective as well.
And as you're saying that, it's kind of making me think, because I agree. I like kind of moving through a day with just flow. Like, when I see something that needs to happen, I just go ahead and do it rather than just going, no, I've got to get back to that desk again, or for you, back to that patient again.
Yeah.
But I think it's that quieter time that you can have, not quieter time, but the less hectic, the fewer things that you feel like you have to get completed today. It leaves space for the gratitude that you were mentioning before as one of your values. I don't know if you can be crazy busy and stressed out and feel grateful at the same time.
That's very true.
So your dental practice is called Dental Code, the website being DNTL for dental, so without the vowels, DNTL code, CODE.com.au. But by the same token, I just did type in Dental Code,
and it came up.
And of course you came up.
Okay. Great, the SEO is working.
It's all working well. It's fantastic. And if anybody is out there that want to get a bit more insight into your journey, and then jumping on the podcast would possibly be the best way to do that.
Yes, 100%. And if I could mention one more thing, we do actually run a dedicated graduate program. Yeah, so both for dental and dermal. But I'm a huge believer in communicating effectively and clearly. And the way that I say something you might not necessarily perceive what the message that I'm trying to give the same way that I'm trying to tell it.
Yeah.
And so we have a huge focus on communication, treatment planning, and clinical skills, obviously. But if you can treatment plan effectively and you can communicate to a patient effectively, then your clinical skills can be learned. Those things also can be learned, but they need to be, I think that it will improve your trajectory and the rate at which you can see improvement and results and patient acceptance a lot quicker.
Completely agree with you, and don't think that just because your patients aren't saying I don't understand that you're communicating effectively. Studies indicate that when one person's talking to another person, they actually walk away with only 50% understanding of what was just been said. And so when you add into that dental jargon, I'm kind of anxious because I'm here at the dentist now. I'm thinking about how much is this going to cost, and I've only got 2-hour parking out the front, and all the other things that go on in patients' brains. I imagine that they would be more than likely leave that area, that conversation with you, and they have even less than 50% understanding. And so having training in that is huge.
And so the communication is about understanding that, but also being able to detect that as well. And so we have dedicated time within our clinicians' books for that specific mentoring. So we have dedication to the graduate program, but also for mentoring, where we meet, depending on how far they are out or in their journey, how frequently that may be. So if they're a brand new grad, then we'll meet every day for the first month or two. And then it might go to 4 times a week, and then 3 times a week, and then 2 times a week, and then, once a fortnight, once they become more experienced and confident. But
that's an enormous amount of support. That's wonderful.
And I've only been able to do that since I've cut back clinically.
And so your satisfaction and for the contribution you're making must be increased because of that. So it's by pulling back that you're able to give more.
Definitely, yes.
Yeah. If people are out there that are interested in that, what's the best next step for them?
So if you go onto our website, there is a recruitment tab, and then that'll take you through the process. We've got a little video about our team and some questions. There's actually the DISC personality profile testing on there as well, which will give you a little bit of insight into how your brain receives information and how you also portray that. They can have a look on there.
How powerful. Well, all the links will be in the show notes, but again, it's dntlcode.com.au, so jump onto that if you're interested in that. Hopefully you'll be able to come back on again if you've got any other offerings going on, and just to keep track of that progress with your fantastic health hub that you're developing.
Oh, I'd love to. Thank you.
Well, thank you so much for being present for this particular podcast episode. I'm so pleased that you're less busy now, so you had the time to do it.
You're very welcome, and thank you very much for inviting me on. I've been listening to your podcast for a little while now, and I was really pleased and chuffed that you wanted to have me on as a guest.
Oh, it's been an absolute delight to get to know you. Thank you so much, and we look forward to seeing you next time that you're on.
Thank you.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. We've got online courses, consulting programs, the club membership. We also have a whole bunch of tools and resources that are available for free that will help you achieve your practice goals. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.